Hi folks, my name is Tommy Gallagher and I'm a physical therapist who specialises in dance injuries. This is the third in our series of videos, and today I want to talk about knee pain and in particular Osgood Schlatter disease. Osgood Schlatter is a painful knee condition that affects teenagers generally between the ages of 14 and 16. Below the kneecap, at the top of the shin, just on the little bony part that sticks out on the tibial tuberosity. And what tends to happen is that when the teenagers go through a growth spurt, the bone grows quicker than the muscle becomes overstretched, irritated and inflamed just where it inserts onto the bone. With Osgood Schlatter disease, the most important thing is rest. When you feel the pain, you must rest until the pain is completely gone. Unfortunately, we see people maybe 6 months, a year after they first feel the pain and they're still in pain because they didn't rest it enough at the start. The pain must be completely gone before you return to activity. The second thing that you must do is try and reduce the inflammation at the area, and the best way to do that is to use ice. A bag of frozen peas or ice straight onto the spot, 15 or 20 minutes, a couple of times a day is going to help to reduce the pain and the inflammation on the area. Now, I said this generally affects teenagers between the ages of 14 and 16. Unfortunately, we're seeing it in kids as young as 10 and 11 because of the amount of activity that they're doing. So ways to try and reduce the risk of getting injured. The first thing you can do is measure yourself on a regular basis. So every 10 days or a fortnight, just measure yourself against the wall. If you see a dramatic increase in your height over a period of 2 to 3 weeks, then that's an indicator that you should probably be pulling back from the intensity of the training and practice that you're doing. Therefore, you're less likely to pick up this injury, not have to worry then about rehabbing it. The second thing is to keep your legs strong when you're not injured. We tend to see this more in people with weak quads, so that when they start to grow, the quad is weakened even further. And people with strong legs, we don't see it quite as much. So when you're pain-free, it's really important that you build up the muscles in your legs to help reduce the risk of picking up this injury in the first place. If you have any questions regarding this or any injury, just drop me an email or a message on Facebook.